Hi, I'm Dr. Perry Godalovich, and in this video I'm going to be reviewing the consent form for a face and neck lift. So a face and neck lift is a surgery we do under local anesthesia with deep sedation. Please go see the video for local anesthesia with deep sedation. This means that we'll be placing an IV in your arm and giving you medication that will make you kind of be in a twilight, but you're not completely under, meaning there is no general anesthesia. This mitigates any of the risks that are related to general anesthesia, so we don't need to worry about things like blood clotting in the legs, nausea, and vomiting. When you arrive for surgery, you'll arrive about an hour before and we'll give you some medication to start relaxing you and bringing your blood pressure down, which is important during a facelift. For the facelift, the scar goes in front of the ear, into the hairline, down under the ear, behind the ear, and into the hairline for the neck lift. The extent of the scar into the hairline in the back depends on how much laxity is at the level of the skin. The other option is that we also use a small incision under the chin, depending on if we have a lot of work to do at the level of the neck. Once we get you into the operating room, you're going to be given some sedation through your veins, and then we're going to be numbing the area with a small needle that you will barely feel. Once the area is numb, most patients fall asleep and they don't feel the rest of the surgery, and they wake up and often don't remember much of what happened. The risks of a facelift surgery are a few that are important to mention. One is the scarring. Most of the time it scars beautifully, but sometimes behind the ear there can be thicker scars or more redness in the scars. If ever the scars are not nice, we will revise them. The other thing to mention is little contour deformities at the level of the skin, and this can happen temporarily for the first 3 months, and this is related to the stitching that is done under the skin. Finally, there are complications related to nerve damage. I've seen one in my practice where there was a nerve here that was in an unusual location and caused a paralysis of this area here. All paralysis returns at 3 months, but it can be very destabilizing and very nerve-wracking during those 3 months. The most common nerve to be affected, it causes weakness of the lower lip, and if this were to happen, we would normally just put some Botox on the other side to equalize the lip as this nerve recovers. So it is a fairly minor complication. Things that patients don't like is the tightness around the neck the first night, which is normal, but causes you to not be able to drink and eat normally for a few hours. The other thing that drives people crazy is the numbness around the ears, which can last up to 3 months, and the numbness at the level of the skin of the face, which is normal, but will return over the first 3 months. You're going to have a small drain at the back of your incisions and a big bandage the first night. We always see our facelift patients back the first day to remove the dressing, remove the drains, and then put a much lighter dressing with the garment. This will make you much more comfortable for the next couple of weeks, and we require that you wear the garment minimum for 2 weeks. The other two complications to mention is something called a hematoma, which is a collection of blood, it's rare. It's only happened to me once, and it is usually related to the fact that that the dressing is removed or not tight enough and blood is collecting. That needs to be removed on the first day if we see it. And infection, which we've seen one time as well, which is why we now give all our patients antibiotics for 1 week.